Hello, everybody. Hope this session will be invigorating, although it's after dinner, everybody is like calming down. And thank you, first of all, for organizing the conference in Poland and turning the light to the east of Europe, to the less favorable countries with less access, less funding. So hopefully this will help us to move forward. What I'm going to show you is our Polish, as a country, how we quickly managed to get PrEP maybe not accessible, available, because with access it's still a long way to go. Just to show you how we started in 2014. Basically, we started in 2012 when FDA registered the first TDF FTC for PrEP. It took us 2 years before we got our Polish guidelines as a Polish AIDS Scientific Society, but still we got them in 2014. But we started with very few real sex clinics, if any, very few real STI specialists. They basically say we are not interested in STIs. So basically patients with any STIs have nowhere to go. Stigma attached still to HIV, STIs, and passive-aggressive homophobia, which is especially frustrating that it happens among medical professionals. I, as an academic teacher, take some blame on me that we are still not doing enough to change that, although we are doing a lot, but basically not enough. And meanwhile, in Poland, we are having 20,000 people living with HIV. It's not as much as in Germany, France, or UK, but still it's our situation. With 1,400 new cases each year, with 70% being MSM. 30% of MSM still do not know about their infection, not because they do not get tested, but because of rapid transmission in ham-sex, during ham-sex parties, in circuit parties. It's too quick. Basically, in Poland, we know it takes 6 to 12 months after I would get infected to pass it to another partner during a ham-sex party. And most patients get tested once a year. So it's still, we had this situation. And about STIs, we know and we see that there are many, but no one really knows how many. The turning point came in 2017 when a generic company, now we have 2 generics in Poland, but then it was 1. They came in June, and they said, we are going to supply you with generics, 30 euros per 30 tablets. It's the same situation now. Both generics do the same pricing. So we felt it is feasible now, because as you saw, I forgot to point it out, that the PrEP cost then 800 euros as original Truvada, and we had only very few patients on that. So it was feasible, so we decided to start, but the first question came to our mind where we should do it, who should do it, which doctors, at what venues, and most importantly, what patients would want. So we decided to do online and conference questionnaires for, mostly we targeted infectious disease specialists because we knew the crowd, so we knew how to contact them, and we also did online questionnaires for patients. And the doctors, this is the doctors' replies. We asked them whether they would be interested. As those were the doctors who already were working with HIV patients, we were not surprised that over 70% would be interested in providing PrEP. But our second question, where should we do it? Should we create new PrEP clinics? Was really quickly answered. We saw that over 50% of these doctors would be able to provide PrEP at exact same places where they are already working. So we had the places, we had the doctors, like just from one day to the other. It turned out that we just targeted the right audience. So the doctors that were already dealing with HIV patients, with STI patients at testing sites. So this was the first answer. We had the doctors, we had the clinics. And what about patients? We just wanted to know what kind of group they were. So 20% of them were diagnosed with an STI in the last year. Diagnosed because most of them had symptoms. We know that over 70% of MSM have asymptomatic infections, but 20% had some symptoms. And this is what I told you about. Only 1/4, 25%, got tested every 3 months, which is basically enough, but still 25% only once in 6 months and once in a year. What was really reassuring and basically showing the same what we were seeing from different trials, that the ones that used condoms the least, they did the most testing. So they were really interested in being safe, or at least getting diagnosed early. So first, on the one hand, we had the doctors, we had the venues. On the other hand, we hoped that MSM would be interested in PrEP. We asked them directly, would you want to use PrEP? 79% said yes. Of course, most of them said that it should be free of charge. But when we also asked them how much would you be willing to pay for PrEP, they said the median was 25 euros a month. And we also asked them how much would you be willing to pay for visits, including testing every 3 months, and they also said more or less 25 euros every 3 months. So we knew in which direction to move, because PrEP isn't reimbursed in Poland, so we had to just create some pricing. And this was quite surprising to us. Where would you want to access PrEP? Any doctor, 45%. This is an important message, but still getting any doctors, like family doctors or gynecologists trained, first of all, convince them that PrEP is something good, that this is a good prophylactic method, would be too long. We wanted to get PrEP available as soon as possible. We started in June, with the company coming to us with the offer, and first clinic started working in October the same year. So very quickly we got it available. This is just an updating information after 2 years of PrEP. So this is new information. If you're using, because we were also interested how many of patients who use PrEP get it online, because there was no way of finding it otherwise. So it turned out that 18% of PrEP users, so basically 1 in 5 PrEP users buys it online. So we also included to our statistics of the PrEP use in Poland. Different signs, but doesn't matter. This is where PrEP is available now. This has different clinics. We have 2,000 patients on PrEP in Poland now. After 2 years, most of them are MSM. But remember that most of the new infections happen among MSM, so that's why with the little funding, we decided just to capitalize on this group. 500 more or less get PrEP online, the rest in PrEP clinics. From January this year, it became possible with e-prescriptions to monitor PrEP use online. Health Ministry can check anonymously how many patients get PrEP and where they get it by zip code, so we know more or less where the PrEP is prescribed, and we can go to the doctors that start prescribing PrEP and help them with anything. And what was really nice to see, because we didn't foresee that PrEP clinics became a real nice point for STI patients not using PrEP, straight, gay, MSM, whichever, just to come to get the STI diagnosed and treated in a really nice environment. And some of them decide to start PrEP. So this is an added benefit with this, because as I remind you, there were no, and still no, real STI clinics in Poland. So basically PrEP clinics took the job. So basically, summing up, the facilitators for this rapid provision of PrEP, unfortunately not reimbursed, were we targeted either gay-friendly or MSM doctors who already worked with this target group. They were trustworthy, credible, and it really crushed the barriers that the patients basically in the very beginning might have. And by word of mouth, patients who came to us, either HIV or PrEP patients, they just told others, this is the right place, this is the right doctor who will not judge you, who will help you. And what is really important is we decided to get one Polish webpage where we connect all clinics with addresses, phones, information about PrEP, and the pharmacies where you can buy PrEP at the discounted price. So this is all from me. now Michał, because all of this wouldn't be possible without social media and the community themselves to spread the message. So Michał.
Hi, I'm Michał Pawlęga. I'm MSM Health Lead in Social AIDS Committee. That's an NGO based in Warsaw. And yeah, thank you for inviting me to speak about community response for PrEP and the community engagement to spread the information about PrEP. And thank you, Bartek, for this very useful data regarding the needs of the users. So maybe some information will be doubled with the Bartek's presentation, but I will need them to explain what is the environment in which we work here in Poland. So the starting point, and still all these 6 points okay, I will continue with that later. So the starting point regarding PrEP promotion. There is social taboo around sex. It's even in LGBTI population, so it's very difficult to talk with people about sex and their sexual activities, and of course their sexual orientation. Hostile political and social environment towards LGBTI people, and please treat my presentation as an example what we can do in countries where living conditions for LGBTI people are not that well, and Poland is one of them here in Europe, comparing to the other countries. So people face discrimination, stigma, of course. Then HIV stigma, of course, also among LGBTI population. A lot of community misunderstandings around PrEP, for who PrEP is, but what also it means if someone uses PrEP. No public health sector support for PrEP users, as Bartek said. PrEP, but also all medical analyzers are paid directly by the PrEP user. And limited resources, I mean financial resources, but also community engagement and community organization, which is not that well organized in Poland comparing to the other European countries. So I identify like 4 assumptions for the interventions made by different activists and organizations in Poland to promote PrEP. And the first assumption, it should engage the community. As you hear yesterday during Łukasz Sabat presentation and today Paweł Zięba, it needs a community engagement, and it should be culturally competent. So we decided it should be culturally competent in the way that we use the language which is used by the community, and of course if representatives of the community speaks to the community and they are recognized, so it's much more easier for people to get this message. Then another assumption, it should focus on the most at-risk subpopulations. So here in Polish conditions, there are those who are very sexually active, but also people belonging to the different fetish communities. And the last thing uses positive messages around sex, sexual activities, and sexual health. And I identified, preparing the presentation, like 3 pillars for community intervention. So it's based on awareness raising combined with the education and information, but mostly awareness raising. I mean that people know and understand what PrEP is, how it works, and if it's for me or not. Then second pillar, potential users identification, which really supports to identify the people and to provide them with the information about PrEP. And there are some institutions or some places where we have easy access to the possible PrEP users, so we can identify people and then suggest PrEP. And the third pillar, easy access to treatment, and I think Bartek spoke a lot about this, so how it's organized. And what I'd like to say, not only those awareness raising and identification is made by LGBTI community, but also those clinics function thanks to the LGBTI community engagement, so LGBTI community doctors or those who are, let's say, allies of the community. Talking about awareness raising, so there are examples what we can do if the resources are very limited and the environment is quite hostile. That's community leaders' engagement. I mean, those who are easily recognized by the community and they'd like to speak about PrEP. And as you see three friendly faces here, Łukasz Sabat, Paweł Zięba, or Caesar, yeah, and Tomasz Siara, and you already met those people during the conference. So that's very useful because majority of the community knows those people, and they are pretty easily recognized during gay prides and other events. The second activity, there are kind of different workshops regarding PrEP. Workshops or movie shows. Probably most of you know the movie of Nicholas Feustel. Thank you, Nicholas, for that. Yeah, every year there is LGBTI film festival organized in Poland, and what we decided to show the movie during the festival and to combine it with the information campaigns and discussions involving PrEP users. But also, there was a series of workshops for those who would like to learn more about PrEP. What was important talking about these workshops, it was organized by the community, but during every workshop, medical doctor was available, to give the people the right medical information regarding PrEP. Then LGBTI media engagement. Yesterday you heard about Replika. There is the only one and big printed LGBTI magazine in Poland, but also biggest website Queer.pl, and one of the radio broadcasting companies. And the last action, but very important, the outreach and community outreach activities made by community, so different organizations. As here you can see the initiative of the Socialist Committee CAMSAX-PL, after party organized by Foundation for Social Education, and also Podwale 7 Association in Wroclaw. So outreach workers meet people in different LGBTI venues, and they promote PrEP. The second very useful pillar, it's identification of potential users. Here in Poland, in my opinion, it works pretty well. There is a network of the community-based voluntary counseling and testing sites, and all the sites are prepared to identify potential users. So due to the recommendations of Polish AIDS Science Society, there is a recommendation to recommend PrEP or to suggest PrEP if someone had condom-less intercourse, especially anal one, in the last year, STD in the last year, someone used PrEP because of sexual activities, someone who is injecting drugs or had chemsex. So there is a recommendation to suggest PrEP in that cases. And this network of voluntary counseling and testing services usually provides the interview before the test, so it's easy to identify people and then to do intervention regarding PrEP. And the last pillar, as you already heard, there is easy access to treatment, and it is possible thanks first for the hard work of people who are members of Polish AIDS Scientific Society. So they decided to put the recommendation regarding PrEP into their general recommendations regarding HIV prevention and care. And thanks for that, every doctor in that country could provide PrEP for his patients. What's important also from my perspective, that those clinics providing PrEP in Poland, some of them are just for-profit initiatives, but some other are absolutely non-profit. So it means they engaged the staff sometimes for free. Sometimes people do this work nearly voluntarily or voluntarily, and that's important from my perspective because it opens more access to PrEP to the people, because the final price is much more smaller comparing to the for-profit clinics. And the last thing, I think also very important, it's the cooperation with pharmacies, which provide continuous access to drugs. So every clinic identified the pharmacy, they negotiate the prices to make PrEP as cheaper as possible. And in those places, PrEP is always available, so people can be sure that if they go to the pharmacy, they will obtain the package of PrEP. Thank you, and let's visit the website, PrEP.edu.pl, which was mentioned by Bartek.